Good morning. Welcome to Conversations with Hannah. This is a very special edition of Conversations with Hannah. We're coming to you today from Town Hall in Shrewsbury. We're recording this on Sunday morning, March 15th. And it's important that I share the date with you because the information that you're about to hear from the guests that we have today is what we know through this morning, Sunday, March 15th. And so it's timely and relevant, but in a matter of days or weeks, it will not be timely or relevant. So I'm joined here today with folks who, like me, serve at the local, state, and in our Regional Health Alliance level. We came together because we think it's important to share information and to also illustrate how we are effectively all working together to deal with this uncharted territory that we all find ourselves in relative to battling against the coronavirus right now. Joining me here today is Senator Mike Moore, my partner on Beacon Hill. We have Superintendent Joe Sawyer, Chair of the School Board, Sandy Fryc. We have Chair of the Selectman, DePalo, Assistant Town Manager, Kristen, Chair of our Board of Health, Steve Vigeant, and our good friend and Medical Director of the Central Mass Regional Public Health Alliance, as well as the Assistant Vice Provost of Health and Wellness at UMass and the Director of Pediatric Trauma Surgeries, are Dr. Michael Hirsh, and thank you for being here with us this morning. Congressman McGovern was going to join us this morning, but has another meeting that he had to be at, and so stepping in a little bit later to give us an update on what's happening at the federal level on Congressman McGovern's behalf will be Senator Mike Moore. But we really wanted to start today by first thanking our friends at Shrewsbury Media Connection for coming out and for taping this show here this morning. They are closed, like so many other services are right now, but felt it was important to be here for our community to help relay important and timely information. We are really in uncharted territory right now, and we're all trying to navigate this as best we can. And by working together at all levels of government, we have the best shot at making sure we're doing all the work necessary to prevent the spread of the coronavirus and respond to it as people do become ill. So, Chair Vigeant, I think I'd like to start with you. Can you give us a little bit of an overview, perhaps on and reminding people that we are members of the Central Mass Regional Health Alliance, what that is, who's a member of it, and then Dr. Hirsh, if you can walk us through, from your perspective, what do we need to understand about the coronavirus, how it spreads, and what we should be doing right now?
Okay, thank you, Hannah. I just wanted to give a brief overview of how the Shrewsbury Health Department works. And as Hannah said, Shrewsbury is a member of the Central Mass Regional Public Health Alliance. It's a coalition of 7 municipalities: Grafton, Holden, Leicester, Millbury, Shrewsbury, West Boylston, and the city of Worcester. And we work cooperatively to create a sustain a viable, cost-effective, and labor-efficient regional public health district. I think one important thing to note is that the City of Worcester Division of Public Health is the first nationally accredited health department in Massachusetts, and the Alliance is the only multi-jurisdictional accredited health department in the country. So Shrewsbury has a unique opportunity here to access the great medical and technical expertise of the Worcester Division of Public Health. So it's a really a big advantage to the Worcester Health Department to be able to have access to this great expertise.
And Dr. Hirsh, can you give us a little bit of background on the virus, why we are doing what we're doing right now? People have seen announcement after announcement. I think that on Monday I was at a Ways and Means hearing which was focused on public health, and we had the Director of Public Health as well as Secretary of Health and Human Services, Mary Lou Sutters, there. And from that moment to this moment today, 6 days later, the trajectory of information that has come out, the closings that have occurred, not just in Massachusetts, but nationwide, I think a lot of people are still somewhat struggling to understand why we're doing all these things. It's very difficult to battle something that you can't see at the moment. So if you can help shed some light on why it is so important that we're taking the steps that we're taking.
Thanks very much, Representative Kane. I'm honored to be here. I just want to say to our Chairman Vigeant that Shrewsbury is really one of the strongest members of our alliance, and we really relish that spirit of collaboration, cooperation. So we, at the Department of Public Health, and also speaking in part for University of Massachusetts, are reeling every day the same way everyone else in the audience is about the new information that's coming out. And we're trying to understand, learning from Italy, we're learning from Asia, how this virus has kind of spread. And we're very, very concerned that the spread of the virus here in the United States has been much more under the radar screen because we haven't tested as much as we should. So I'm going to start with some basics. Coronavirus is a cousin. This coronavirus, which they call novel coronavirus, is a new form, new, of a virus that we think was involved with causing the common cold for many decades. But this one apparently jumped from an exotic species in Wuhan City in Hubei province in central China. And because of the density of the population there and the elderly population they had there and the lack of quick access to hospitals there, it spread very, very rapidly. The response to the Chinese government was the kind of draconian thing that we're hoping we don't have to get to here, where the whole province was isolated. They had to build 2 hospitals, which they did to their credit in 1 week's time, to take care of the ill, and they had to upgrade their number of ventilators and medical staffers. And you probably know one of the first docs who discovered or recognized this was a new type of respiratory illness died in the process, and many healthcare providers there got the virus. What we learned from the Wuhan experience is that this virus spreads by respiratory droplets. So it's characterized with a dry, hacking cough and a fever, not so much like we have in the flu, where every bone in your body aches and you're coughing up a lot of phlegm. This one is mostly chest-related discomfort because of all the coughing that you're doing. But the coughing is the way the droplets kind of shoot out. And the thought is that a 6-foot radius around the person is a danger zone for anybody else in that, which is why the whole issue of social distancing has now been promoted. What they found in Wuhan is that of all the people that they tested, 80% of the people did not know they had anything wrong with them. They were walking around symptom-free, feeling really great. 20% had symptoms. Half of those had very mild symptoms. They might not have ever sought medical attention, but they were mandated to be tested. The other 10% had symptoms that made them seek medical attention, and half of those ended up in an ICU. And half of those ended up dying. So that's how Wuhan came up with about a 2.5% mortality rate. In other countries in Asia, such as Singapore and Japan and Korea, South Korea, where they've tested many, many, many more people than even China had, the numbers seem to show a lower mortality rate, because the more people you test, the more people you realize people are just walking around doing their usual things without knowing that they are carriers. Yeah. And that includes, to our dismay, we're not seeing a lot of children get sick, which is great, but they may be carriers. And we all know that they can't obey recommendations like stay away from your face and eyes, don't touch your this, don't touch it. You know, they can't do that.
I know from when my kids were at Lilliput, that there would be something in the school and my kids would be fine and I would get it.
Yes, right. And that's a big reason that Mr. Sawyer, among the other superintendents in Central Mass, decided to do a school closing now, because everything we're trying to do now is trying to slow the upward curve of the viral impact, which we know is coming. You know, Dr. Fauci, who is like, the guru of virology for the National Institutes of Health, is telling us that curve is inevitably going to go up. But if it goes up too rapidly, the medical system will crash.
Do we have any idea how long before that curve we see it? I heard, and again, watching the news this morning, they said April or May. Is that?
I think by mid-April, we should see a big inflection going up. I think in that maybe month that we have now till then, if we do the right things, and that would include school closings and limiting crowd sizes and getting rid of people in restaurants with more than 50 people there, and really emphasizing that people that do have cold symptoms or of any kind should not be going to work, should not be going out, should not be going shopping. That's, I think, very, very hard, but that's where we have to do the shared sacrifice thing. We have to pull together, get the information to the community, which is, I think, so great that you're doing this today. We need to make sure that people understand we all have skin in the game, because even if we're walking around asymptomatic, the vulnerable population, which is over 60, people with pre-existing conditions that particularly affect the lung, like emphysema, asthma, people with cancer, people with immune disorders like HIV/AIDS, or people that are being treated for some of these autoimmune diseases like lupus or rheumatoid arthritis. These are the people that are the likely people that would get into that 10% needing to go in the hospital, and then worse, flooding the ICUs.
So, sorry, I have allergies. Allergy season's coming upon us.
Yeah, I do too.
So how do you know the difference?
How do you know? You don't know. I think, for someone like you, and I'm hoping I get an excuse too, that we have responsibilities that make it very important that we're at the table at a lot of meetings and things. I think so long as we don't have a fever is really a big part of the symptomatology here.
Okay.
So if you're not febrile, and I would urge people to start checking their temperatures, because sometimes you don't know whether you're febrile. Mm-hmm. So what is febrile meaning? A fever higher than 101 would count as a real fever. Low-grade fevers.
Consistently, or just one day?
Well, we check, for example, the people that are self-quarantining, we check twice a day. We check them in the morning, we check it at 4 o'clock. Most people, if they have a febrile illness, will spike around 4 o'clock. So that's when our nurses are doing the checking. And we're following out of the Worcester Department of Public Health. Our public health nurses follow folks in Shrewsbury. So if you're not febrile and you just have, say, a little runny nose or itchy eyes, but when you have your allergy season, the dry hacking cough is usually not a common allergy symptom, and that's really the herald to me.
Okay.
Fever and that dry hacking cough, everyone describes that as being really important as an early sign of having symptomatic coronavirus.
And Dr. Hirsh, and I think part of the way that people need to understand this too is the impact on the healthcare system with all these people is one thing. We also have an existing number of people who rely on the healthcare system for other reasons, some of which may be very serious and life-threatening. And so when you have the amount of people who are going to need to be focused on this, it's also curtailing or making it more difficult to respond to other people who are ill. So how we've seen, my daughter is a patient at Tufts, and we've gotten the emails about canceling any elective services, canceling any important appointments that can be pushed back a week or a couple weeks at this point. So can you talk to us about how the healthcare system is, you may be hearing from your healthcare provider, non-related to coronavirus, on something that you may have as a health problem because of the potential impact and the need to keep the hospitals as clear as much anything that is non-emergency related.
Yeah, I think those are great points, Representative Kane. The hospitals, I think, are now canceling elective procedures, elective surgeries, elective x-rays, and things that can obviously be put off. But if you have a life-threatening illness that needs chronic therapy, chemotherapy, any kind of infusion therapy, they're going to service you because they know that can't be put off. But your well child checks or your routine visits to the physician on a yearly checkup, that's going to be delayed. And we're hoping we'll use the month of April to take a little hiatus. And I think that the hospitals are truly gearing up. They've converted at UMass, for example, where I do most of my work. We have 2 floors now that are being prepared to be ventilator floors. And we've gotten more ventilator equipment in. And we have a recovery area in surgery that's like an auxiliary area that we had long prepared for it to be used in case of a disaster. All those disaster plans have really proven their worth this week because we're just activating that. So we'll have the surge capacity. But if it turns out to be that we're on the Italian curve, we still could get overwhelmed.
And right now in the state, as of yesterday at 4 p.m., the state is reporting every day at 4 p.m., updating our numbers. We were at 138 people positive, including 2 in Worcester County. And the state lab had tested at that time 475 patients. And we've been a little bit hamstrung because we haven't had the number of tests that we wanted to have here. That changed yesterday. It's changed over the last few days. We now have 3 other labs that are able to do testing in addition to our state lab. And we also, how the test has to be done has changed a little bit. I don't know if you want to mention that and what that will mean in terms of our ability to test.
Yeah, well, first and foremost, I would say our 2 big hospital providers here in the Central Mass area, St. Vincent's Hospital and UMass, have both set up testing stations in tents outside of the hospital. Now, these are, I don't want it to sound like you're going camping. They're heated, they have lighting, they have seating, and this is really for the person that gets triaged to be someone of interest in terms of having some of the symptoms or having been in touch with someone that clearly did have the virus or is suspected to have the virus. So that's been a really important piece of the puzzle. Our dispatch service, so Worcester EMS is a predominant server in both Worcester and Shrewsbury, has a special protocol now. The dispatchers have a set of questions that they ask about travel, about exposures, and if you identify yourself as a risk person, they respond to you immediately with individuals garbed in the appropriate personal protection equipment. They put a mask on you. When you arrive at the hospital now, you will not go into the main hospital. Unless you're in severe respiratory distress, you will, but you'll be put into an immediate negative pressure room very close to the door so you don't expose the rest of the staff. I don't know if you heard this week, a patient walked into a hospital in Queens, New York, and Far Rockaway, and knocked out 40 medical providers, which, most hospitals can't easily rebound from that unless they start working double shifts and asking for overtime. Then you get your staff run down, and it ends up being a vicious circle that you lose your staff, and then you can't take care of these patients no matter how much capability you build up. So I think that's one of the ways the testing is going to be better. The testing is also not going to have to go all the way down to Atlanta. It does in terms of verification numbers for the CDC, which is based in Atlanta, but we'll be able to confirm the testing locally, and that should be a 48-hour turnaround. Cleveland Clinic announced this week that they've developed an accurate test that can turn around in 8 hours, and we're hoping that the federal government may give them the authorization to, spread this without concern about the patents and all the other stuff, so that we can get the turnaround much quicker.
And we saw that in the Berkshires. We saw that there was a number of people who work at Berkshire Medical Center who then had to be self-quarantined because of their exposure to the people who came in there. And I think that there's been a little bit, I think, of a misperception, because early on it was only thought that you could get it by either being traveling to where there was a site of it. But we do have some community spread that we can't quite always figure out where their source of getting it was from, which again is why it's so important to limit any sort of large groups or having some of the things that we've closed down. And because again, we're not entirely sure, this is so new, exactly how it all works. And because it is so highly contagious, we've taken these steps on closures.
Right. And I think, again, the virus is, even if 2.5% is truly the number of percent mortality, or if it goes down to closer to 1%, which they're seeing now in Korea, if we allow the virus to get to, let's say, a quarter of our population, which would, roughly be something like 80 million people, 1% is a lot of people. Mm-hmm. The Spanish flu back in 1918 that everyone talks to as the last great pandemic infected a third of the world's population. And in the United States, it killed 675,000 people, which is the equivalent today of about 10 million. So we don't want to go, nobody wants to go there. It's not about percentage, it's about everyone will know somebody that unfortunately doesn't survive if we allow this to get out of hand.
Go ahead.
Good. Sorry. We're talking about people going to quarantine. I had a facility, I don't know if they want to be identified, but that does detox for people. Now they've got extra beds, so they want to volunteer this space in case we have an issue with a lack of space for quarantine. Who do they notify?
If they call the Worcester Department of Public Health, I'm doing coordinated calls starting tomorrow with St. Vincent's and with UMass every day. And their emergency preparedness and infectious disease docs are going to be on the call. So if we learn that they're getting overwhelmed, we would need to kind of have those kind of surge capacities and extra beds. And I think the only thing we would have to do is try to, get them inspected even in the short term to give them the dispensation to say, yes, these are appropriate beds.
Okay.
It would obviously not be for patients with ventilator needs. It would have to be for, the less serious cases. And honestly, the less serious cases, we don't have a treatment other than supportive care. So it would be probably chest physical therapy and monitoring patients to make sure they didn't get a bacterial super infection on top of the virus, or having the ability to get oxygen, because that's sometimes hard to do.
And I think one last thing, and then let's turn to you. Just a reminder that a lot of people, again, they talk about the flu and they compare this to the flu. And I think, again, from a healthcare systems perspective, almost all of our healthcare professionals are vaccinated against the flu. So when somebody is presenting at the hospital and they have the flu, there is a vaccine that's giving protection to the healthcare workers. Because we have no vaccine right now, again, that exposure that's occurring in the healthcare community has the potential, again, for taking people out of our healthcare system that we need working there. And so that's why I think a lot of the precautions that you've talked about are being done to ensure
we don't know if this is going to be one of those viruses that visits us every year or periodically. We don't know, but we think there'll be a vaccine available in 12 to 18 months. They're really rushing as much as they can to produce one, but they have to first test it. And once that happens, once vaccination happens, it's a different ball game. And we don't know if it's going to morph into different strains like the flu does, but at least we'll have a little bit of herd immunity by getting that vaccine out there. One other thing I wanted to say, Representative Kane, and I don't mean to monopolize the talk at all. Very simple stuff that people kind of hear and they say, "Oh, come on, really? This is like the answer to the epidemic." Hand washing. 20 seconds, warm water, multiple times a day. Even if you haven't been anywhere but your workstation. In the city, they've just put out cards at every single workstation asking our city employees to wipe down with alcohol wipes their keyboards, their telephones, their knobs on the door handles. There's reminders in the every bathroom to wash your hands 20 seconds, warm water. We're providing as much of this. I know this is very, very short supply right now. You can't find it on the shelves. We've gotten a consignment now from we're part of a regional emergency preparedness program that includes 74 towns in Region 2, which is central Massachusetts, and we've gotten a consignment of these now. I think we'll be able to make more of these available. There's a lot of home remedy things going around where you can, take some rubbing alcohol if you can get that. I'm told that's also short supply, and mix it with aloe vera or lanolin, and you get yourself a modification of a hand sanitizer. And I'm told that Tito's vodka doesn't have enough alcohol in it, so you have to go for something a little stronger. But these are very important things. Coughing, if you have to cough, crook of the elbow. If you're doing a lot of coughing, you should be staying home. Mm-hmm. And the handshake thing, I mean, it's very hard. It was amazing to watch President Trump talk about all these things, and then he shook hands with 4 CEOs in front of everybody. And, if he knocks out the 4 CEOs of the 4 largest drugstores in the country, I'm worried. But
I think it's hard. I've been walking around holding something because I think we all naturally just sort of, it's very difficult to get your mind around that. But I think those are all wise things. And I really we're so appreciative of everything that's being done in the healthcare system to prepare and to respond to this. And I really thank you for being here and being part of this conversation today, because I think it's really helpful. I think the point that we wanted to make here today, too, is that all levels of government are working together. And Congressman McGovern couldn't be here with us this morning. I've been texting with him this week. A lot of what you see happening is happening behind the scenes, but the conversations are occurring. And we do have an update on what's been done at the federal level this last week. And I know that you were going to give us a little bit of an overview on that, Senator Moore.
Before I hit that, just quickly on what you were talking about, you saw the president shaking hands. So much of this is done subconsciously. Like, I'm sitting here and I can feel myself scratching my face, and you're saying, "Don't touch your face, don't do that," but you don't even realize you're doing it.
Right.
But the virus can live on surfaces supposedly for 7 to 9 days. Mm-hmm. So it's going to be a tough one to really, kill. But I think we have to get a new consciousness about it, and it's just going to take a little time,
Do we produce antibodies? Do you know once you've been exposed?
We don't know that yet.
We don't know yet.
We don't know that yet. All right. We don't know that yet.
Okay, thank you. So again, as Representative Kane stated, Congressman McGovern couldn't be here, but what we have for him for an update is that last week, I think as most people have seen, Congress approved an $8.3 billion package that went to President Trump, which he did sign. And that funding included $3 billion to develop a coronavirus vaccine, including $300 million to ensure that everyone has access regardless of their ability to pay, $2.2 billion in public health funding for the prevention, preparedness, and response, including $1 billion specifically to alleviate the immense financial strain on hospitals and healthcare systems, $1 billion for medical supplies and medical surge capacity. Friday night, Congressman McGovern voted yes on the Family First Corona Response Plan that passed overwhelmingly with a bipartisan vote. This builds on last week's bipartisan emergency funding package, which established free testing, providing paid leave, supporting strong unemployment benefits, protecting frontline health workers, expanding food assistance, and he also reached out to Governor Baker and the Department of Public Health and all the other federal and local stakeholders, trying to facilitate a conversation on what they think their needs were going to be in the future. The congressional delegation right now is working right now to ensure that Massachusetts has the appropriate tools and information. We need to have a robust and effective response to this. Earlier this week, Congressman McGovern held a conference call with local healthcare providers in Central and Western Mass to listen to their concerns. And I also do know that if you want to reach out to Senator Markey's office, they've put out his recommendations or responses that he's tried to that he's fought for in the Senate version of these bills. So other than that's what we have for the federal response.
And I know that they're working. Our federal delegation has been helping us. As a state, we've been asking for more testing capacity, and that's been something that they've been working on. We've also been asking out of the national stockpile more of the personal protection devices that are needed in our healthcare systems, because we haven't had enough. We did get 10% this week of what we were requesting from that, and we're prioritizing that. So immediately there was a whole bunch driven out to the Berkshires because they were in demand. So federal and state is working really closely on those efforts as well.
But I did get, I was, one of the local police departments did reach out to me, and that's a problem they have in getting the N95 face masks.
Yes.
So working with the federal government and state public health, we're trying to facilitate getting that. I think that's one thing we should maybe try to stress. I know everyone, when we're going to CVS and we're going to all these, the grocery stores, everything's sold out. But try to remember that there are some people that do need supplies for other medical conditions.
Yeah. That
when you go in there and you're taking 8 bottles of alcohol or 8 bottles of something else, that may be something that someone else needs on a daily basis. It's nice to, I guess, I don't want to say stockpile, but try to, think that we do have other people in the community that may need those resources.
I think that's very true. And this week, as I mentioned early on, we had a Ways and Means hearing. You and I are both on Ways and Means hearing. It was a already scheduled meeting, and it was with some of our folks in the healthcare system. And from that point on, daily the governor has been holding press briefings and updating us and announcing things. So sort of looking back over this week, on Tuesday, the governor declared the state of emergency, which granted him and other state officials some more flexibility in terms of how to respond to this, and allows access to some funding. On Thursday, we in the House and the Senate, in informal session, meaning we didn't have to be there to actually cast a vote, it was done in informal, but passed a $15 million fund in response to the outbreak of COVID-19, which again, gave broad flexibility to the Department of Public Health on how to use those funds. So we're really trying to provide the resources, but not limit them in a way which, creates an artificial issue that we then need to deal with. We also, at the State House this week, basically have shut down our offices. So everyone who works at the State House is now working remotely. There's a little bit of an issue for us in terms of access to some files at times, but for the most part, we wanted to have people, again, working remotely and not coming in contact unnecessarily with people. And so my staffer has been working out of her apartment in Somerville. I have been working from home. We are still a functioning government. We don't need to all be there in order for government to function, but we're trying to lead by example as well, and make sure that we are not having unnecessary social contact with people when it's not necessary. So our phone lines are still open. You can call us. We will get right back to you.
Email. Just give us some time on the email.
But just know that our folks are not in the offices right now as we attempt to do our part.
You might want to mention too, we also, there was a Ways and Means hearing scheduled for this Monday.
Right, we've canceled that.
That's been canceled. So anyone that's an issue that we're going to have to try to address, is that legislation requires public hearings, so we're trying to figure out how we go about addressing that now. And I think the House is probably doing the same things that the Senate established a working group. So if anyone has any suggestions on what they think we should be trying to pass to support the community, please email our offices so that we can put those suggestions forward.
And to your point about having the public hearings and meetings, the governor's office did make adjustments to the open meeting law so that we could accommodate the work that we have to do in a much more safe manner. So there's remote participation and things of that sort. So we're going to be now, and we've been talking about it in town, but we're probably going to be implementing something like that as much as we can. But that'll be a big help to keep government going for the necessary things we have to do and still do as much as we can to minimize exposure.
Yeah, the announcement that the governor made on the emergency order temporarily modifying the state's open meeting law means that you can establish quorum remotely. You don't have to be in person to do so, and you can use telephone and other virtual ways to conduct meetings, which was really important. On Friday, the governor announced an emergency order prohibiting gatherings of 250 people or more. There are some carve-outs to that, but largely, again, the goal is to limit any large gathering. We also saw throughout the week a lot of announcements on the major sport leagues, as well as here in the Commonwealth. We're moving the always favorite marathon, Boston Marathon, will be now in September. September 14th is the date that we're working on to reschedule it to, which was, again, an important step. Another piece on Friday that was really important, the Department of Public Utilities announced a moratorium which requires that there cannot be any shutoffs to electric or gas utilities right now, and that includes municipal light plants like Selco. So Selco is part of that as well. I think as a town, we would not be doing that anyways, but I think it's important across the Commonwealth to understand that we are recognizing that by this limiting of normal business that we have, it may mean some people might not be getting a paycheck and not be able to make a payment that they needed to make. And so we are trying to alleviate that. I also have seen things like Verizon, again, giving longer times in order to pay bills and things. And I think we'll continue to hopefully see that from other institutions as well. Yesterday was a very important announcement from the governor, and he set up a coronavirus command center and put Secretary of Health and Human Services, Mary Lou Sutter's in charge of it, and basically all levels of the executive office have somebody who is going to be serving in this command center, and it is a way to streamline decision-making and dealing with all of the issues that are coming up. Right now, they're really focused on how to expand capacity and distribution of testing, because we believe that's really important, as well as that allocation of the personal protective equipment across the state, and as we get more in. But this is essentially, they are doing the scenario planning. They're trying to figure out what are going to be the next set of issues that we're going to have to figure out potentially as a Commonwealth. And certainly some of the supply chain questions as well. So the good news is the secretary is actually left in charge, somebody else in her office, her day-to-day job, and is completely focused on doing this work to make sure that decision-making is streamlined. And, you know, in addition, there are several pieces of legislation that have been put out there by our colleagues that we are in the process of evaluating and being part of. Things like making sure that for public employees who may be new and not have established enough sick time, that they would have access to taking those sick days and would be compensated so that they don't have to wait. There are other things that we're doing relative to acknowledging what our first responders and people on the front lines of this issue, to your point earlier, what do we need to protect them, as well as what do we need to do, again, if they get into a situation where they are either have the virus or they need to be quarantined, to ensure that they are not dealing with any issues relative to time around that they have the capacity to do that.
I guess just go along with Representative Kane's talking about, I know one suggestion that's come forward is trying to look at some sort of loan forbearance or forgiveness while people are out of work, something, so that, you know, we don't want people not being able to not pay their mortgage payments or other types of payments. Almost similar to what Department of Public Utilities is doing. Just try to, you know, the last thing we want to see is people on the street. So we're looking at other suggestions like that also.
And I've started to get emails and phone calls, I know you have as well, from small business owners in the district really worried about what's going to happen if they don't have the foot traffic coming in to buy their materials. A child care provider emailed me last night saying, I anticipate none of my parents are going to bring their kids here, and that's my only form of income. What should I do? And so we're working through a lot of those issues, and we're responding, and both of us will be putting up as much information as we have on our Facebook pages as well as emailing out. So we are working on all of those issues to assure everybody. There are some small business administration loans that are going to be coming out that people can apply for to help them as well. And I think too, again, to the point on insurance coverage, Mass Health, which is a healthcare provider for 1.8 million people in Massachusetts, has, again, put things into practice like telehealth. So if you need to talk to a doctor, you don't have to come into the doctor's office. You can consult over the phone. We are doing 90-day prescriptions for people rather than the traditional 30 days. We also, to the point earlier, will be covering, as will commercial providers, the cost of testing and potential vaccine if and when it is developed for this. So a lot of those things are all being worked on, and they will continue to be worked on at the state level. At the local level, which is day to day, where most people, yes,
Do you mind if I have Dr. Hirsh a quick question,
You may,
since you were talking about that? And I don't mean to prioritize one profession over another, but as we're getting concerned about people, and I know we're going to move to the school conversation, early ed educators. If people are going to be staying at home or kids not going to school, is there any way, I mean, is it appropriate to be prioritizing certain professions for testing? Because if we're going to need early educators or people watching the kids while people are going to work, is that appropriate? I mean,
I don't think we really haven't discussed what the teachers will be doing in terms of their screening and things like that. I mean, certainly if we have a 2-week hiatus and no one in these schools have been identified as having the virus, I don't think we're going to treat them any differently. But certainly now that docs can directly order this without the approval of the Mass Department of Public Health or the CDC, I think certainly if a teacher is concerned themselves, they can satisfy their worry by just getting tested, and they can go to their local PCP, not if they're symptomatic, but if they're just worried about an exposure, and get the doc to order the test. But I don't really think we've had a special concern about a group like that yet. It's only been mainly first responders, healthcare providers so far.
okay, sorry.
No, that's a good question. So, on a day-to-day basis, local government is where most people are touched. And so we've talked about what we're doing on the federal and the state level and in the medical community. But, most people are really looking for guidance and information on the local level. So Chairman DePalo and Assistant Town Manager Kristen, if you want to update us on what are some of the steps that are happening on the town government side, and then we'll turn and get an update on our schools.
Well, just generally, excuse me, we've been working at the town level for 3 to 4 weeks on this. There's been a lot of meetings, taking a lot of guidance through the leadership of the Worcester Regional Health Alliance. And we're following the state and federal protocols and the guidance that they're giving as it comes out. We are working and putting out information to try to limit people coming to conduct their business in town hall as much as that's possible. And this week we'll be moving forward on how we're going to handle the other important business we have to do. But Kristen really has more specific information, but I would say if people want information, obviously the CDC and NIH are great places to get information. They're probably the best places to get information. But as we get information, we're also posting it on the town website. So Having said that, I'll ask Kristen to go through what they've been working on in the past couple of weeks.
Sure. Thank you, Rep. Kane, for gathering us all. It's definitely an urgent matter that we are taking under serious consideration, but again, no sense to panic at this time, just making sure that we're taking care of our neighbors and our families. Mr. Mizikar, the town manager, wishes he could be here, but he had an unrelated personal matter, so he has had me step in at this time related to the coronavirus. So again, he will be back in the office tomorrow after he takes care of that personal business. Like Mr. DePalo has said, we've been working for 3 to 4 weeks on the town level to understand what this virus actually means, what it means for our town and our community, how we can keep our employees safe, but how we can also effectively run a government that serves over 37,000 people in population. On Friday, before we left the office, we did issue a public notice that was published on our town website that goes over the items that we are currently doing to keep our town safe at this time and prepare for a virus. I can report at this time, so it's Sunday morning, that the town of Shrewsbury does not have any positive cases of coronavirus. Right now, our town hall buildings are open to the public, but that is subject to change. As Mr. DePalo stated, we are encouraging people to do as much business over the phone or online as possible. Our building inspector's office has online permitting for buildings. We do have online payment for bills. I know excise taxes are due tomorrow, so we do have that online payment option. We also have a drop box at the front of town hall that we would encourage people, if they're paying by check, to use that drop box or just mail their bills or any other information to the town hall. Again, this information is fluid and ever changing, so this is what it is as of Sunday evening. We'll be reviewing the requirements as possible. We're also meeting with our staff frequently of who has capabilities to work from home if possible, if we need to do shift work at all. So we're working very closely with our IT department on who has laptops, who has internet at home, who needs the VPN access. And we are working on our departments of a continuity of operations plan of if something were to happen, town government does need to go on. We do need to keep the water and sewer operational. We do need to continue to pick up trash. We do need to make sure that our finances are in place. So that is an effect there. As of this afternoon, we will be announcing that the library and the senior center will be closing to the public. The employees will still be going in on a day-to-day basis. The library will be issuing some information about curbside pickup and other online services that they will be offering. But in light of the schools closing and recommending that people stay home and avoiding social contact, we have closed that library down for the foreseeable future. We do not have a date of reopening yet. Likewise, we are closing the senior center for the public. That is our most vulnerable population. We are trying to find a way to still run the Meals on Wheels to make sure that meals can get out to the public that needs it. We will also hopefully be working on a system of the people who come to get meals at lunchtime would be able to perhaps do a takeout option. Again, still working in the background on that. And as of today, transportation will still be running through the senior center tomorrow. Again, this is all subject to change, so we appreciate your patience in that. On a police, fire, and EMS level, we had an emergency meeting on Thursday and have certain operations in place related to what our first responders will be doing related to general cases, general operations of police and fire, and then if there is a suspected case of coronavirus, what we will be doing to keep our residents safe, but also our force safe, because as we said, if a hospital were to go down or our police and fire, we'd be in a difficult situation. We have restricted town employees from going to conferences or seminars out of the building. Many have already been canceled. We are working on remote participation related to video conferencing. We're still coming up with a policy, as Mr. DePalo outlined, of public meetings and public gatherings, that we will not have public gatherings. We're working on ways that our boards and commissions can still meet when necessary through video conferencing or telephone. So we appreciate the governor's emergency order on that. That greatly helps us continue to operate our business operations. And we have linked up again with the Central Mass Regional Public Health Alliance for a special telephone number for those who are in need of more information. We have also posted a myriad of information on our town website related to the CDC, what our town is doing, and other related credible methods and outlines. So thank you.
That's great. And I should mention too, there is a state number as well, 211 system, which you can also call into. They have operators who are fluent in Spanish, but they also have access to 150 other languages here in the Commonwealth that they can. So anyone can call that number, also looking for any statewide information regarding the coronavirus and potentially prevention symptoms and where to get tested. Information is provided on that as well. I think that as a parent with 2 children still in the public school system, I appreciate how challenging it is from your perspective to navigate this uncharted territory, and I thank you for the work that you've been doing. If Chair Fryc and Superintendent of Schools, Dr. Sawyer, could you tell us a little bit about, I know you had closed the schools on Friday and then announced that we're going to be closed this week. I think just thinking through what are some of the things that you all have to think about in terms of how to respond to this. And I know too that there's been a robust conversation among school districts together, sort of how to approach this. So we're not one-offing something, or we're relying on what others are doing too as guidance. And so I'd welcome your
Sure, I can start, and we did close the schools this past Friday. I was just about ready to send a communication to families about various restrictions we were going to be putting in place relative to activities and public access to the schools and things of that nature when this situation continued to evolve so quickly. And ultimately, we felt that given what was happening, it made sense to hit the pause button and cancel school for Friday so we can get a better handle on the situation. During that Friday, we had multiple conference calls, State Mass Department of Public Health, the Department of Elementary and Secondary Education, and there was a further conference call just for superintendents with the Commissioner of Education. We had a meeting of all the town department heads that Ms. Lass coordinated. I had a conference call with other superintendents from Central Massachusetts as well, and we also had a conference call meeting with our leadership team here within the district. So a lot of communication was happening, and as those watching the news know, most school districts in Eastern and Central Mass, I think, or at least a majority, are closed at least for the next week. I made the decision to close for 1 week as we continue to get more information about the situation. We know some districts closed for 2 weeks. We know Worcester is closed now for 3. Boston took the step of closing for 6 weeks. And one of the challenges is that there's differing levels of advice out there from medical professionals. The advice right now from the State Department of Public Health is that it's not necessary to close school districts unless and until there's an identified case, either a contact just for some, a couple days for cleaning and tracing contacts, or if there is a staff member or student who is confirmed, that there would be a 14-day closure, but at a school level. And then if there was community transmission, that there'd be a district level recommendation for closing for 14 days. The concern I know that I had and many superintendents is that, and as Dr. Hirsh mentioned earlier, because the level of testing has been very low, there's concern that there may be a number of individuals throughout Massachusetts, or certainly central and eastern Massachusetts, I know the Berkshires as well, that may be transmitting and people don't know it yet. And I know there was a great sentiment that was being expressed among the parent community, as well as internally by our staff, questions about, what do we really know about what this transmission looks like. So we felt it was prudent to go ahead and close for a week. I indicated I'd make a decision on whether to open the following week by next Thursday. That decision certainly could come sooner than that. We're going to be taking stock every day, of course, and we're basically operating in a crisis management mode at this point. I think that the families should prepare for a longer closure. I think that would make sense right now. And if we do return to school anytime in the near future, I think you can expect to return in a way that there are going to be a lot of restrictions on interactions and public access, volunteers, people coming to, concerts, performances, things of that nature would likely be restricted for some time as well. But it is tricky. Just in the Boston Globe this morning, and again, we're taping this on Sunday morning, there were a couple of different pieces from medical experts in the Massachusetts community. One that's sort of indicating, like, if you see transmission, then you can close. Another indicating that all schools should close right now as a preventative measure. So again, I'm not a medical professional. I'm usually reluctant to substitute my judgment for that of the others. But there are some conflicting pieces out there, and when that happens, I think it's best to be cautious and take it one step at a time and be conservative in our approach that way. I think that, in terms of what this means for our families, the decision to close school for an entire week and possibly longer is a major disruption to our families, to our students, obviously to our staff as well. It creates issues around students who rely on our school not only for education but for nutrition as far as meals, especially students who are get free and reduced lunch and breakfast meals from us. It creates a real issue for childcare, of course, for many families. And also not to be lost is the fact that many of our students really rely on our schools for a great deal of social and emotional and mental health support. We're working behind the scenes very diligently to try to determine how can we provide these things in a different kind of manner. I think the bottom line that I want to make sure people understand is that we are going to continue to play a key role in our community even when the schools are closed. We're going to need to take care of our students. First and foremost, I know there have been a lot of questions about school meals. We already have been working on a plan to provide meals in some way. It could be probably a grab and go lunch bag type of approach. We've already been in touch with St. Anne's Food Pantry. We'll be working in conjunction with them. And of course, they're a very important element, and a lot of our families who also receive free or reduced lunch at school also access the food pantry at St. Anne's, and so it's good for us to be coordinating. We're going to work to do that as quickly as we possibly can. I expect we'll have an operation up and running this week. How soon this week we feasibly can do that right now is what the question is. The federal government will not be reimbursing us for those meals because the waiver that the state's getting is that only school districts with 50% or more students who receive subsidized lunches will be eligible for reimbursement from the federal government. So that is something we're going to have to tackle on a local level. But I'm very proud that not only have we had a number of staff who've reached out to me already and to our administrative team about what can we do to help these students. A number of parents have also been communicating with the district saying what can we do to volunteer, provide resources, and that's something that we will be. And I know St. Anne's has indicated they prefer cards to local supermarkets is probably the best thing, that if you want to make a donation to St. Anne's Food Pantry that could be helpful to our community, all kinds of families in our community. So that's obviously our students' health and well-being and meeting their and food security are the most important things. Second, we're going to take care of our kids in terms of educationally the best we can. It is going to look very different. We cannot just flip a switch and become an online learning environment for all kids preschool through grade 12 over a few day period. We've been doing planning behind the scenes knowing this is a potential situation. I think what the families will see and students will see are some initial communications early in the coming week around some ways to stay engaged. We know that providing some structure for students is important. It's important for them and their families. So we'll be doing that, and then as we ramp up other kinds of efforts, we'll be clear about what that looks like. I think that it's important that we provide some of that structure, and that our district's motto is empowering learners. I think there's going to be opportunities to really empower our students in different ways appropriate for their developmental needs depending on their age. That said, we don't want to overwhelm our students with good intentions either. I don't think it's going to be helpful to, obviously there's already a lot of stress and anxiety in society generally around this issue. The last thing we need is one of our high school students receiving 25 emails from 25 different well-intentioned educators about all the work they need to do over the next few days. That won't be helpful. So we need to be clear and concise and consistent around how we're approaching that, and that's work we'll be doing over the coming days as we shift into this. And of course, if we're going to be closing school for any extended period of time beyond next week, it's going to look different than what maybe a one-week closure would look like. So that's something we'll have to consider as well. I'm really pleased that a lot of our folks are taking proactive stances. I know that our school counseling department at the high school reached out. I know Ms. Fritz has some information on what they conveyed to parents, if you wanted to share some of that.
I know this came out last night, and especially at this time of year for college seniors who are moving on to college and those college acceptance decisions. Things that are canceled in March is the March 26th MIFA. After the acceptance seminar, families can access financial aid resources on the MIFA website, which is at mifa.org. The March 31st mini college fair is also canceled. And yesterday's SAT administration was canceled, and students may access further instructions about refunds or exam makeups at collegereadiness.collegeboard.org. In addition, the National Association of College Admission Counseling college fairs have also all been canceled for the spring season. And one final piece of their request for students, they are in the process of signing up for classes for next year. Students will be asked to take a picture of their completed course selection forms and email it to their counselors. Parents and guardians can also help by making sure the form is complete, including 3 alternate electives and parent-guardian signatures before emailing the form. Again, you can get all of this information on the Shrewsbury Town School webpage. And now Wynn has, again, sent this out last night, our Director of Counseling.
So that's just one example. I'm seeing a lot of different things from educators, and certainly our leadership team has been very on top of this. Our principals this morning have pieces that are out to our different educators, essentially surveys. What are the questions our teachers and support staff have that we can answer for them? And we're going to be providing more and more detailed information in the coming days. The more certainty we can provide, one thing that people have been asking is about the school calendar. The State Department of Education did provide, the commissioner provided a waiver in the sense that any days lost beyond the original sort of 5 days that have to be built into the calendar for snow days in the first place would not be required to be made up. We will hit that date as of Monday, and so I'll be asking the school committee. They have a scheduled meeting right now. Whether it's going to be remote or not, we don't know yet, but for this coming Wednesday evening, one thing I'll be recommending to the school committee is that they adjust the calendar, that regardless of how many days of school we lose that we're not present, that the last official day of school will be June 19th, which would be the earlier, that would conform with the state regulations. What that will also allow us to do is make sure that teachers, who are paid on a salary basis, we can be utilizing their work from home during that period. But that's the other piece. We're going to take care of our students. We're going to take care of our staff, and finding ways to make sure that they understand what's expected of them. Obviously, we're working with hourly employees around expectations around pay. And initially, we've been very clear that's for this coming week, beyond Monday, which is considered a day that'll be made up at the end of the year when they would be paid, that we will be paying them based on what their typical hours would be on Tuesday through Friday, and I'll be working to determine what that will look like as far as a longer closure. But in terms of, we have a very good infrastructure for remote learning for our middle and high school students because of our one-to-one technology device program. We have a learning management system that's online. Elementary will look different, early childhood will be even more different than that. So providing the right kinds of supports will be important. But depending on the type of position one of our educators has, some teachers it's very natural that you can do some things at home. Others, maybe not as much because it's the nature of their role and how is it, whether that's a school counselor or whether that's a physical education teacher, whether it's someone who's a support position like someone who's a paraprofessional aide supporting kids in our district. So that's the work we're doing over the coming couple of days to try to determine and working with our employee associations how we can best make this work. But I'm very confident that our staff will rise to the challenge. I'm confident our community will do the same. And certainly what we ask right now is patience and understanding as we work through what's really an unprecedented situation. And I would say if you want to add from a school committee perspective.
Thank you again, Representative Kane, for putting this together. I think it's important for people to hear from us directly. I have the utmost confidence in Dr. Sawyer and his staff to lead us through something, like you said, is uncharted. We've never done this before, but we've got good people in place and to make sure that we're doing the best for students' health, but also for their education. And again, I would repeat, I hope parents understand that it's new and have patience, and your office is doing the best it can to get everything out as timely as possible. And for anyone in the community to look at the school department webpage for any new updates. Pay attention to your email as things come out. I do have a question for Dr. Hirsh. If you could speak a little bit about the whole social contact, because this is not a snow day. I think, families need to understand that maybe getting together with play groups and things, this is not probably the time to do that. It's not convenient to have all your kids home all the time, but if you could really speak to the importance of that.
No, I think that's an excellent point. We don't want to see school being replaced with big play groups, and I know as challenging as it can be to have your kids home and kind of not with their peers, I think that's really the way that we would hope people approach this. Social isolation is not easy on a kid. They need stimulation and they need a lot of attention and distraction, and hopefully we'll be able to do that either with some online programming, and I know that that's what they're trying to do in most of the school districts in our Central Mass region. Also some, just basic screen time that is constructive and not destructive. But you're absolutely right. We can't have big play dates. That doesn't mean that we want the people to necessarily be, cloistered in their house, can't go outside, but they shouldn't go outside in groups, and they should find ways of just taking a stroll, walking around. If they have access to a backyard or a park where they're not going to be in close proximity to others, I think that's the way to go. Unfortunately, it's going to be a very different new normal for a little while.
Thank you.
One thing that we didn't mention is that all the recreational programs, the town recreational programs, are canceled for the foreseeable future. So that'll be a big disruption for people also. But it's important that we don't get together in those groups.
You said the reimbursements for only communities with over 50%?
That's correct.
So how many communities actually does that cover?
I don't know the answer to that.
I think that's something we can work on, though.
Yeah.
Perhaps we can look at that at the state.
Yeah,
some
I mean,
sort of-
I would imagine that's not a large amount.
I think you could assume, most of our gateway cities and major cities that would apply to, but, and depending on, so it's really going to be tied to the socioeconomic status of that
Right.
particular community. But for sure, just for context, Shrewsbury is at about 15%. So we're not even close to that threshold.
I was going to say, I think that's I know for my senators, I think that's actually pretty low. Most of my communities are up like maybe between 25 and 30, so.
And that's a
Okay.
great question, because I think as we look at budgets, it's something that if the two of you could help us
Yep.
on
Yeah.
looking for some possible reimbursement of that.
Absolutely.
Okay, good.
Those
No,
are the
thank you.
types of
Yeah.
things that we want to know about so we can figure out. And also to be feeding in, because again, the state is looking for us to help provide what's happening in the communities, where are the needs and what should we be able to do. I do think that, Dr. Sawyer, you referenced, it's a different learning environment. I do hope that what our students and our children are learning from this is the right way to deal with the unexpected in life. And I think that hopefully they are seeing the steps that are being taken, especially again where it's not something that's visual. Like, it's really hard for people to understand why we're doing all of these steps right now, particularly to our kids. And I think that I'm really, and I know Senator Moore is as well, feel so blessed to represent this community who operates on a daily basis as a highly functioning entity, but particularly right now where we're dealing with this uncharted territory and trying to navigate our way forward. I really do want, and if the one takeaway today is, understand that the folks sitting here are working really, really hard to make sure that we are responding as we can with the information that we're getting in real time, and that the decision-making is being done in a very purposeful way, and that all levels of government, local, state, and federal, are working together. And on the local level, all the different boards, from the Selectman to the school committee to the Board of Health, everyone is working to very much ensure that we are taking care of people in our community and also preventing the spread of this highly contagious virus that we do not yet have a vaccine for. So I want to thank all of you. This was an opportunity that really came about yesterday afternoon. Thank you all for being willing to be a part of this. I think it's important, and we will continue to find ways to sort of jointly show to people in the community of Shrewsbury that we are all working on their behalf at this time. So thank you very much for joining us on a special edition today talking about the coronavirus. And please do take use of the different ways to keep informed and make sure that the information sources that you're using are trusted and known information sources. And please help us relay this information in our community. And one last plug again for St. Anne's. St. Anne's will not be having the food pantry open, but they will be providing grocery cards to people. So if you would like to help, the best thing that you can do, no matter the size of the grocery card, it doesn't matter. But if you'd like to donate something, you can drop it off in the rectory mailbox or mail it to St. Anne's at 130 Boston Turnpike in Shrewsbury. That will be a huge help as they look to support the people who do not have enough access to food in our community. So thank you.
One last thank you.
Sure, you can thank you.
One last thank you to Representative Kane for putting this together for us and for the community.
Thank you.